Hello and welcome everyone to Career Shades once again. And today we are here with Dr. Krishna. She is a cosmetic dentist, has experience over 7 years, and she also does baking as her part-time gig. So welcome to our platform, ma'am. How are you doing?
Thank you so much for having me. I'm great.
So, ma'am, my first question to you is, for our audience, can you please first of all explain that what exactly is being a cosmetic dentist? What exactly it is?
So cosmetic dentist is nothing but the aesthetic dentist or a smile designer. So
Oh,
in case you have crooked teeth or in case if you have overlapping teeth or something, I design smiles. That is my superpower.
that's great. I guess that explains that how do you have such great smile? But
Oh, really? Thank you.
yeah. So, how can you define a regular day in your life?
So there is nothing known as a regular day in the life of a dentist because it's not like a normal 9 to 5 job. We have appointments. There are days when we have a lot of appointments. There are days where we have comparatively, we have less appointments. So
Yeah.
it's not, there's nothing known as a regular day for me, but like on a general routine, I follow a few things. I like to work out first. So that's like the first thing that I like to do in the day. After working out, I go to the clinic. I have some morning preparations in the clinic in which I delegate some work to my clinical assistant. She makes routine calls to the patients. Then, if I have some previous patients, she does some follow ups. And then we probably try to call patients every morning just to assure that, they are well aware that they have appointments on the same day and they end up coming on their respective given times. So that's how I do my daily chores. And once I'm back home, we have this routine is like it's there since 4 years, ever since I've got married. Is we have our dinner together. I have dinner with my in-laws and my husband together. After which we will go to one of the rooms and we will play any multiple player game or any Ludo or whatever, just so that we can discuss what has happened in each one's lives. And it just gives us the
Right.
liberty to understand. Plus, it's like a very good thing. Like at the end of the day, a family that's coming together, that's playing together, having some fun times together is always staying together. So that's something that we
Wow.
do.
Well,
Yes.
that looks like a perfect work-life balance for you, right?
Yes, it is. Have to be, right?
Yes, it should be. So, if I'll ask you that,
True.
can you mention one thing that you love about your profession? What would that be?
Um, there's not one thing that I love about my profession. I love
Okay.
everything about my profession. I love each and everything. But the highlights can be that because I am a cosmetic designer, the main thing that I love about my profession is I'm a smile designer. So I make people
Yeah,
smile. So what can be
true.
the best thing, other than making people smile? So that's like number one highlight of my profession. Second would be that I ease my patients from the pain. If, for example, if a patient comes to me with a swelling or any sort of pain,
Yeah.
I ease them with their pain by medication or with any clinical treatment. So that is also something that I love about my profession. The third highlight can be that I inculcate a positive approach in my patient. For example, if a patient comes to me for a routine cleanup,
Yeah.
so we as dentists, we can look in the patient's mouth, or we have that particular sense of smell, and we can look at particular stains in the mouth, and we can identify, oh, this patient is a smoker, or this patient is having tobacco.
Right.
So by giving a positive approach, I mean is I try to educate my patients that you should stop this habit because it has a lot of disadvantages, and at the same time I try to highlight the main points, like if you stop it, you're going to have healthy gums, you're going to have a beautiful smile, and it should just be good for your health. So I try to educate them. I'm sure that 10 out of 10 patients may not listen to me, but if I'm able
Right.
to bring that one change in one patient, what else can I ask for? So these are like the highlights of my profession.
A lot of things I can see, as they say that being a doctor is really satisfying. I can see that actually.
Totally, absolutely.
Yeah. So, ma'am, is there anything that you don't like about your profession? There has to be something.
Um, like I said, I love everything about my profession. So there's rarely anything that I don't like about my profession. But I can say that the takeaway when it comes to long sitting hours, we have to sit in a particular posture when we're working around the patient. And
Yes.
sometimes we have some complex procedures wherein we are attending the patient. We have to strain our back, we have to bend, or sometimes we don't have an access over a particular tooth. So we
Yes.
have to probably just move our back in a particular posture and, just move our heads and all of that. So in that case, I think the back really goes for a toll. It just, the
Oh,
postural pain sometimes at some days, it's like something that I don't like. But other than that, I love everything.
right. But I guess your workout
Yeah,
must be helping you with that.
I'm sure it is.